Thank you, Mr. Green. Next, we have Rae Nadler-Olenick.
Good afternoon, Mayor and Council members. Last May, Mosaic, the supplier of the fluorosilicic acid that Austin uses for water fluoridation, updated their material safety data sheet to include a dire health warning. And here it is in their words, quote, prolonged or repeated overexposure to fluoride compounds may cause fluorosis. Fluorosis is characterized by skeletal changes consisting of osteosclerosis, hardening or abnormal density of bone, and osteomalacia, which is the softening of bones, and by mottled discoloration of the enamel of teeth if exposure occurs during enamel formation. Symptoms may include bone and joint pain and a limited range of motion. Now, that's what we've been saying for years, and here it is straight from the supplier. For the last several weeks, we've been making an effort to get this information to both council members and their aides through hard copy and emails, and so far we've had no feedback. Last summer, the Austin Water Utility issued a weak warning strictly limited to dental fluorosis in infants, and they placed it on their website where no one will see it. Today we are demanding that the water utility place on their bill where people will see it the following meaningful warning. And this is the language we've chosen. It all comes from the CDC, the MSDS sheet, and the City of Austin's own website. Quote, in January of 2011, the CDC lowered the maximum level of fluoride recommended for tap water from 1.2 parts per million to 0.7 parts per million. Austin currently fluoridates at 0.7 parts per million. Prolonged or repeated overexposure to fluoride compounds may cause fluorosis. Fluorosis is characterized by skeletal changes consisting of osteosclerosis and osteomalacia, and by mottled discoloration of the enamel of teeth if exposure occurs during enamel formation of children and infants. If you are concerned about fluorosis in infants and in children, you can minimize exposure to fluoride by using non-fluoridated water for children and for reconstitution of infant formula. End of quote. That would be a meaningful warning. And we are further demanding a direct response to us within the next 30 days. Thank you.